I am Luis Carriere from Barcelona. I am the inventor of the Carriere motion appliance. If I have to define myself, I would say that I am a dreamer. And when somebody is a dreamer, it's trying to imagine a world that could be easier for our patients or easier for our doctors. Is one appliance that was conceptualized for the simplification of the treatment of the sagittal problems in our patients. We identified that the aligners are a fantastic element to solve the malocclusions, but they lack the control and the efficiency on the sagittal dimension. So the best way was to hybridize. And what this means, we have a technology that is capable of arriving to a certain level. Then we observe around and we say, look, this technology and the other technology arrived into place it on top of my technology, will boost us exponentially to a new level. This is what I'm talking about. Motion appliance and aligners, it's a subject of hybridization in innovation. So what we have done is to try to bring the best of the sagittal approach with the motion appliance, obtain an easy and efficient correction of the sagittal problem, establish a super class 1 occlusion of the posterior segments, and then switch into a short treatment of aligners. My approach in class 2 and class 3 is always the same. I start with the motion appliance. In an average of 3-4 months, we accomplish the perfect overcorrected class 1, even if it is a class 2 or class 3, and then we scan. We maintain with an invisible retainer at night what we have accomplished after the motion in the meanwhile that we receive the aligners, and when we receive the aligners, then we switch them and we keep going until the end. If you treat a malocclusion of class 2 or class 3, and you try to do it in virtual reality with the program, with the Studio Pro, for instance, you will see that the major number of aligners is focused on solving the sagittal condition. If we want to treat a malocclusion that has class 2 or class 3 malocclusion only with aligners, the only thing that will happen is that we will have tremendously long treatments, inefficient approaches, and the reason is because the aligners have not been designed for the use on sagittal dimension. So trying to solve the sagittal problem, we are consuming a lot of energy that should not be consumed if you want to have an efficient treatment time. And normally the average time or the average number of aligners is in between 14 aligners, 13, 12 aligners to 25 aligners. This is the range of number of aligners to solve a malocclusion. Amazingly, with the motion appliance, what you do is you bring the posterior segment and you open the spaces in between the incisors. Aligners are perfectly defined and conceptualized to move efficiently to that are spaced in between. If you want to deal with crowding, it's much more energy demanding, but dealing with the spaces in between the incisors is fantastic. The diminishment of number of aligners, of number of necessary aligners in malocclusions of class 2 and class 3, in relation with treating them with only aligners, it was in an average of in between 70 to 55% less number of necessary aligners.